All right. Hi, everyone. Hi, I'm so excited to be here. Another story of hope. As always, I will say the same thing I always say. This is such a good one. Yeah, you guys take notes. This is Jocelyn. She has had a hell of a journey on a secondary
Mm.
infertility journey. And she is now 24 weeks pregnant with a healthy bambino. You could show your bump if you feel like it.
Oh, she's down there. Maybe I'll stand up at the end.
Yeah, yeah, no pressure.
The shirt is becoming
Um,
a crop top, but
oh, and
nice,
a healthy baby girl, right? Baby girl.
healthy baby girl.
Oh,
Yes,
I love it.
we're very excited.
So obviously I know your story. I think everyone wants to hear your story, and you have a good timeline that you've mapped out
Sure.
prior to meeting me and my team and then since. So I'll let you start and I'll just kind of do my thing and interject and
Sure,
back
sure.
yours.
Okay, well, thank you all for tuning in. I just want to start by saying how if you're here in this call or if you're listening to it after the fact, you're already doing a great job moving towards improving your chances for your family to grow. You are absolutely in the right place, which is not something you often feel or hear in the fertility cycle. Aimee and team are just they're incredible. They are true experts in the field, and I consider myself so blessed to have found them and worked with them. And I'll run in through my sort of traumatic history prior to and also post meeting them. And I'll try to be as brief and quick as I can. Uh,
No, take your time. I mean,
well,
it's important. I think so many girls that are going to tune into this will relate. That's what I would say.
okay. Okay. So, as Aimee said, I was a case of secondary unexplained infertility, that horrible phrase that you so often hear when you know, don't have success right away with growing your family. Back in 2018, my husband and I began to try to conceive on our 5th month, which I blissfully naively thought was so long. At that time, I was, I think, 33. On our 5th month of trying, we did conceive at home, and our daughter was born in May of 2019. Anticipating that our second try might take a little longer than that 5-month period, I sort of looked at my husband around the 1.5-year mark and said, "Hey, let's maybe start trying in case it takes about a year and a half." I was, I believe, 36 at the time, or
Yeah.
35, 36. Um, and what we found was 6 months later, at my like, this is the window. We call the doctor next month. We actually did conceive at home again. Ecstatic. I mean, we were like, this is the best thing ever. Blissfully unaware that a positive test could not potentially yield a live child. We confirmed via blood work that the beta was doubling. Unfortunately, on our 3rd visit, we found out that it was going to be a chemical pregnancy. That I will say, of all my losses, which I continued to have several more as the years went on, the first one really, really, I think was I don't know if I'd say hardest, but it was the loss of blissful pregnancy. And
Yeah.
I
You
am,
lost that ability to be naive. You can
yeah,
no longer. Yeah.
yeah. And I really just, I remember the day after being told that the beta was not doubling and that the pregnancy would not be viable, um, crying myself to sleep and then waking up that morning. And for a brief moment, I just thought to myself, oh, it's a nightmare. Like it was that didn't happen. Like that couldn't happen. And that second where I stood up and realized, oh no, that's happening. Like that's real. Um, that it was so awful. I mean, it just anybody that has gone through loss knows that feeling of where you feel like, is that real? Was that a dream, a nightmare? Um, Anyway, I went on to pass that one at home, very painfully, by the way, but did not need a procedure. Then, of course, I was absolutely distraught. We headed to a fertility center in our network. We began our consultations. That was back in July of 2021. We started with, and again, greeted with, oh, you got pregnant twice on your own. This is going to be a quick, you guys just need a little IUI, no problem. We won't even need to medicate you. Well, 3 IUIs later, all negative tests. We also I developed an ovarian cyst from the medication, Clomid. No success there. Then again, the reassurance from the team, oh, you guys will have no problem. Let's just do IVF and we'll get you your baby, and that's something that I don't think people realize with secondary infertility. Sometimes you can sort of be taken for granted because you have had a baby before. Sometimes people are just like, well, it wasn't the right egg. Next month will be, and they sort of like,
or like, you already have one at home, be
how
grateful.
grateful. Yes, exactly. And of course you are grateful and you fully recognize that. But it just was a particularly like it was an undercurrent of our handlings with doctors that sort of now looking back on really felt irresponsible, for them to sort of just overlook our case because we had success once before. So we did move to IVF. Our first retrieval, unfortunately, when we had our genetic testing come back, none of the embryos were workable. So at that point,
and you're 35 at this point, 36.
So I would have been, it was May of 22. So I am what, 30? Yeah, 36, 30. Yeah. 30.
And how many did you retrieve?
Might have just turned 37.
Do we send off?
Sure. So the first retrieval, we did low stim. So we had nine eggs, I think, retrieved, and only 2 fertilized, which was very upsetting.
Yeah,
but
very low fertilization.
Very low fertilization. We did not do ICSI with this doctor because the practice believed that, they didn't like ICSI. Right. They just didn't feel like it was, they felt like there was a reason certain sperm would not fertilize. So those 2 embryos or those 2 fertilized eggs did become 5-day blasts. And like I said, they sent them out. One was abnormal, one was high level mosaic. And the doctor did not recommend
I remember
transferring. Yeah. Again, we waited like a week and a half. This was like sort of when COVID protocols were still a little in place. So we did a virtual meeting, and the doctor we just felt very unsupported by, not really dialed in on our specifics, was misquoting numbers during the call that we were so desperately like latching onto for emotional support. So we actually ended up switching clinics at that point. We switched to another clinic in our area that was a kind of like a big practice, a lot of locations throughout New York, New Jersey. And we had teamed up with a wonderful doctor, a reproductive endocrinologist, who we just felt right away was already on point with the emotional support. In July so 2 months later, we did a second round of IVF. And at that point, the doctor had said, listen, I don't know why they wouldn't do ICSI with morphology being a slight factor. That seemed crazy to her. So we did a second round, and believe it or not, we had worse results. So we retrieved about the same number of eggs, but then we did not end up with any 5-day blasts. So that was devastating, because here we were feeling like, okay, we have the right team and we're doing ICSI, so it's going to work. And boom, terrible results. At that point in time, we said to my husband, okay, my reproductive endocrinologist right away was like, all right, gluten and dairy free for you.
I was going to ask, diet stuff hadn't changed yet, right?
Diet stuff had not changed. So she switched us to gluten and dairy free.
Which that's amazing by the way, for a reproductive endocrinologist. Oh, if you want to share her name, you can.
Sure. It was Maria Costantini Ferrando, I'm sorry, out of RMA in Englewood, who I love. I think she's an incredibly capable, wonderful reproductive endocrinologist. So that being said, we then implemented strict changes. So gluten and dairy free for me. My husband was eliminating alcohol entirely. So he had stopped drinking. And again, wasn't that he was super excessive, but
Yeah.
he was more than the one recommended drink per day, which, ladies, if you're facing low fertilization, morphology issues, you have to look at those external factors for your husband
100%.
because it's
Yeah.
important. Um, and again, you're going to do so much on your end. You have to have a partner who's willing to meet you there halfway as well. So that being said, we were about, I guess, 5 months of gluten and dairy free, or 4 months of gluten and dairy free. Also remember, sperm turns over between like 70 something and 90 days. So, it's not just like stop drinking for a weekend and boom.
Gotcha.
It's got to be a few month commitment. So that being said, December 2022, we did our third egg retrieval, and my doctor increased my dosages of medication, and we retrieved 16
I
eggs.
love that.
We had 12 of them fertilized. So again,
There you
this
go.
fertilization was undeniably better
Yeah.
once we removed alcohol from my husband's life at that point. Then we had 8 made it to blast. We tested 8 and 3 came back perfect. So we were ecstatic. In fact, my nurse, when she called, even told us, well, with 3 embryos, we can almost guarantee a baby. So, it was like the best holiday you could ever imagine. That January, we prepared for transfer. First transfer was everything you want it to be. It was seamless. We were both there. I go in, for the beta test, doubling beautifully. Then we have a yolk sac, an egg sac. We have or yolk sac. Then we have a fetal pole. And I'll never forget it. I was getting my daughter ready to go to swim lesson, and all of a sudden I felt a little wet. And I thought to myself, oh, it's a little early to be peeing. So I was like, well, all right. I looked down and just blood. It was so traumatic. My daughter, thank God, was able to be distracted by something over there. And then I was home with her by myself, just hemorrhaging in our downstairs bathroom. Um, Come to find, I called the fertility center. They basically said, listen, don't get upset. Just take it easy, rest your feet. Like, it could be a subchorionic hematoma. Everything could be fine with the baby. It's not an uncommon thing to happen in IVF because you're stimulated with so many, artificial drugs. It's extra blood buildup. Okay. We'll have you come in first thing tomorrow morning. Of course, I slept terribly that night, went to bed, just flashing back to the loss of, years earlier. And went in, and I'll just never forget it. I was with the covering physician at that point. They inserted the wand, and I was ecstatic for a brief second because the yolk sac was there. So I thought, oh my gosh, I didn't pass anything. It's still there. And then I remembered we were like 2 days away from the heartbeat scan.
Yeah.
There should be a flicker. And I just saw this empty little sac, still in my body. And I was the one that said, I don't see a flicker, before the doctor did, because, it's a hard thing to deliver to someone and a couple. And she finally, after a moment, said, I don't either. Yeah. And so, again, this is part of the process that I think, people feel like, oh, you had a loss, but when you're doing as much as you're doing, particularly when you're going the fertility route, but even just along the way, like going and being told, well, you know what, we need you to come back in tomorrow because your doctor wants to confirm. So you're gearing up like, okay, now I got to watch this screen again another day
Almost
in a
24
row.
hours. Yeah.
And, it's like the re-trauma, like, it's so intense. And then, okay, they'll call you to schedule the DNC. And then, you don't get the next day, you get 2 days later. So you're just walking around knowing you have this little
I know.
bundle that you were so excited about that's just not there anymore. And it's still a piece of you. And then when they take it out, you're just like, oh my gosh, this is terrible.
Mm.
You know, and then the bill comes in the mail for your abortion and you're
Oh,
like, ugh, this is awful. Like everything about it is just brutal. Um, anyway, so that was the end of our first transfer. But we again were
yeah.
told you have two more. So you're, you know, it just wasn't that one and move on to the next one. So we soldiered on and, you know, we did a recurrent loss panel, but not really a complete one. We just kind of did the major clotting factors. So the five, we found out that I had a
Two. Yeah.
heterozygous factor two, like slightly increased risk, which ironically, when I think back to my genetics 23andMe that I did years ago, that came up as like thrombophilia, like you have a slightly
Right.
higher
Right.
increased risk of lower leg clots, you know, but never would have thought anything about it. But here we were heading to the hematologist, being told by the hematologist, oh, look at all my factor two babies, and, you know, walking the hallway with all
Yeah.
the
Yeah.
pictures of Christmas and everything. And, you know, just being told, like, this is how you're going to fix it. We're going to do the baby aspirin and the Lovenox combo, and boom, you're bringing your baby home. Again, it's sort of that overlooked because we've done it before, we can do it again. Um, Second transfer was particularly tough because it was a positive beta. So you do the 2-week wait or the 10-day
And
wait.
you're on the baby aspirin and Lovenox for this one. Yeah.
Yep, baby aspirin and Lovenox priming leading into and continuing. And, you know, unfortunately, it was a low positive beta. So it was that, if I recall, the gray area, which means it could jump or it could stay very low. And unfortunately, as was the case with the second transfer, it jumped, but too low. So I had to go back in like 3 times to confirm that it was not going to be viable, which again, you're just sick every day about it. And then, so that was the third loss. Then the third embryo, all of a sudden, it was like, oh my gosh,
Yeah.
we got to do this again. Let's do it. And it was the exact same thing. So the third embryo, unfortunately, was also a low positive beta. So another chemical pregnancy. And, you know, it was brutal. But I remained so hopeful. You know, I told my husband, I was like, hey, babe, listen, we got to get ready for another egg retrieval. Like, we need to be back to gluten, dairy free. I think I might have been doing most of it at that time anyway. But I was like, hey, babe, like, you just spent all summer enjoying having beers by the pool with buddies and friends at barbecues. Like, we got to get back on it. So he did. You know, and again, it's not an easy thing to cut out for the men because it's just not typically what needs to happen. But for some people, it does. So we did that. And I again switched to full gluten and dairy free again. And where am I in the story? Okay, so, oh, that's what it was. In the fall, or yes, so my third transfer failed. And then fall, I contacted your team because I was like, well, I've heard good things about this program. Let me see. So I did a 1-hour consult with one of your clinicians, Carrie, who I adore, and you know she was wonderful. And if anything, I think we might have done 2 hours or so over the time, but we just kind of talked about getting my mind right and getting, you know, things in place, supplements I could be taking, things like that.
And then like
So,
tweak the diet more, I'm assuming, and make sure
yeah,
thyroid and D and all that. Yeah.
yep, exactly. Then that December, so about 90 days later, we did the fourth retrieval. And I will just never forget this because, again, I went into the fourth egg retrieval thinking to myself, okay, we just had 3 embryos from the last one. We figured out the cocktail of meds I need. We had almost the same exact results. So last time was 16 eggs, this was 15 eggs. Then I think it was like 8 made it the
Yeah.
week, and then we sent out 6 for testing. When I tell you the phone call that came in at work, finding out that the 6 embryos that were tested at $300 each, by the way, were all abnormal. I don't think you can feel lower than we like.
Yeah.
that moment. I mean, when
That,
that
and
was the
that's it.
first time in my life I truly felt, is this not going to happen for us? Like, are we done? I truly felt it. And I was terrified. Um, we absolutely were at wrecks that holiday. We pulled through for just the sake of keeping it together for our daughter. But we met with our doctor who was like, we just have to keep going. Like, let's
Yeah.
do it again in January. And I just thought to myself, like, how can I do this again in
Yeah.
January? I just put my body through so much. Like, I can't do the same thing in January. Nothing has changed. Why
Yeah.
would I do the same thing? And that was when I started seeing your functional fertility programs. You guys were doing a new session starting in a
Yeah.
cohort in
Yeah.
January. And I said to myself, literally the definition of insanity is doing the same thing over and over again, making no changes and
Yeah.
expecting different outcomes. I said, I have to do something. And I looked at what I had done previously and I thought to myself, the only thing I have not done is internal, extensive work to improve myself physically. I have just soldiered through as this broken person for so many years now, months, like, oh, just keep going because I was not going to stop.
Yeah.
But I just was like, there has to be something different that I do this time. And that's where I found you. And I began your 6-month functional fertility coaching program, working with not you directly at that point, but one of your coaches.
Yeah.
And we as a team started the egg quality diet, which, you know, if if for nothing else, if you are not in a position to be able to do the functional fertility coaching, or you're not there yet, or I would encourage every single person on this call to look into the egg quality diet. It is a book you can buy on Amazon.
For $16. Yeah.
Yeah, it's so worth it. And it is the best thing you can do, not only for your fertility, but truthfully, I think for your overall health and wellness
Yeah.
forever.
Yeah.
The things I've learned from this book and from this program working with you, there is no way to go back. Like,
Yeah.
I can't eat out of plastic. I can't use plastic forks. I can't use plastic. Like, everything plastic in my house is gone. My non-stick, like everything that you have shown me has truly enhanced my life and our family's health. And it's not just a temporary thing to get
Right.
pregnant. It is a forever change that you will make because you
Yeah.
are educated and informed.
Yeah.
And I can't thank you enough for that.
Yeah.
Now, going back into it. So for January 2024, I dove all in on the functional fertility coaching program, started the egg quality diet. I have never cooked more. And when I tell you, I am not a cook. I like ever at all. I was making the most delicious and somewhat simple. Like, listen, there were definitely some that I was like, okay, that is above my pay grade on the skill set required. And then there were others where I was like, yes, that was delicious. I will do all those steps
I
and
could do
make
it
that
again.
again. It was
And
so
Joe
much.
was into it, right? He was
Oh my
eating.
gosh,
Yeah.
Joe. Well, that's the other thing. Joe was eating everything. My daughter was devouring all the meals.
Yeah.
It's nothing like this was the first, like, diet has such a negative connotation, right?
I know.
This was the first meal plan, I would almost call it even more, where I felt like I wasn't skimping on anything. I was truly just like expanding my palette, if you will. And it really was so nice. And your program, I love that it allows you to individualize, right? So it's not just like a one, like this is going to work for you. It's like, hey, eliminate these items and then slowly reintroduce them individually and find out that, like, oh, you know what, when I eat black pepper, like I don't feel great after it.
Yeah.
Or wow, when I have onions in something, all of a sudden I'm bloated the next day. And it's, listen, we know certain foods bloat us and make us, whatever, but sometimes you don't, and you're just eating them a lot and you don't realize it. So that elimination diet was so helpful in that way to sort of figure out like my specific body.
Yeah,
So
what
yes,
works for you.
the
Yeah.
book that you buy works for me, works for Aimee, works for Carrie, works for,
Yeah.
you know, the next
Yeah.
person, because it is very individualized. Like I found that I was able to eliminate caffeine. I could not, like, when I
Yeah.
tell you the clarity I felt by eliminating it, I was like, this
Wow.
is unbelievable. The idea of not having caffeine for me then, you know, I will say with the pregnancy, I introduced the 1 cup
Yeah.
since, but, and I feel okay with it, but I did go to like the green teas more than like the true coffee. So it's just, it's like amazing how you really learn your body, and
Yeah.
just optimize your health. And then in turn, happen to also be optimizing your fertility, which is
Yeah.
fantastic.
And your partner's health and fertility
Oh
too,
my
if they're
gosh.
doing it
A
with you, which,
hundred
yeah.
percent, 100%. And, you know, you just learn a lot too. Like you learn what the difference between, you know, cage-free eggs and pasteurized and, you know, and it's pasture raised. And,
Yeah.
you know, you start learning those little subtle differences that make all the difference.
Yeah. Yeah.
And it was really amazing. We, of course, I was eliminating alcohol. My husband was eliminating alcohol at this point. And then in May of 2024, so it was what, 5 months of
Yeah,
the
5 months. But
program.
we'll talk about, because also the emotional piece with Sam, like when you first
Oh,
went into
hello.
Sam in the
Yes,
program. Yeah.
yes, of course. So again, the functional,
Interjecting only because I know the case.
please, oh, please do. I'll go on tangents all day. So the functional fertility coaching program itself, you know, offers a really multifaceted approach to, you know, kind of, I don't know, I don't want to say healing you,
Yeah,
but
I'd
really
say
it
healing. I'd
does,
say
like,
healing.
I think
Yeah.
that's the best way to say it. You know, it hits it from the biological elements of
Yeah.
food and diet, and just, of course, your medical
Yeah.
ailments and things that you're bringing to the
Yeah,
table.
your specific
But
case.
you
Yeah.
also are encouraged to really look at the emotional components that, again, when you're a long haul fertility person like I am,
A
you know, you
warrior.
just
Yeah, you're
are
just going through.
suppressing constantly because it's just, you don't have time to unpack it because
Yeah.
you can't, and it hurts too much to do that. And you know, one of the perks or one of the things I loved about the program was that we had a nice little support network of other women who were in different situations but similar places, you know. So whether it was someone who, you know, maybe hadn't gotten a period in years, or maybe it
Yeah.
was someone who had, you know, really tough endometriosis, but, you know, you were all coming together with this common goal of supporting each other and listening to each other and hearing about each other's successes and being like, oh, pelvic floor therapy works. Like, okay, maybe I'll
Yes.
add that to the list, you know,
Yeah.
like all these different things of like, wow, maybe I'll try it. Or, oh, you found an acupuncturist that tried that style or this thing. And, you know, and it just was so amazing. And of course, you know, I could not be here without acknowledging Sam Silverberg, who is just an incredible person and professional as well. She is a therapist who was able to support me in the ways that I just needed. You know, I
Yeah.
didn't need, you know, like to unpack so much from prior to fertility, you know, but fertility world needed unpacking, you know,
Yeah.
and
It's a lot.
so it was so helpful to have Sam as a resource and just, you know, have days where I would be like, you're not going to believe this, but somebody who wasn't even trying just told me they're pregnant, and I faked my way through a happy thing. But, you know, and of course you're happy for that person, but
Yeah,
you're not
but
your
you're
best self
crushed.
when
You're
you're
crushed.
so crushed internally, and you're just, you know, you can't help but it's not about their happiness in that moment. It's
Mhm.
about your sadness. And you're like,
Right.
you're just melting every announcement you hear. Oh, I wasn't even trying, or my husband
Yeah.
doesn't do
Yeah.
anything to help us get pregnant. We just do. He looks at me and you're like,
Yeah.
oh my God, my husband can't look at me more than this. You know, we are
Not
like
happening. Right.
everything, Chris. But you know, it's one of those things where it's just, it was so wonderful to have somebody
Yeah.
who I could vent to and just leave it there and then come away and feel like, okay,
Yeah.
because it can't just be your husband, right? Because
No.
he's going through, or your partner, I should say, because they're going through the same things you are in a different way, though,
Yeah.
very different way, right? The person who has the burden of the physical,
Yeah.
is very much wrapped in the emotional and mental as well, but that doesn't negate their experience
Yeah.
either. And
Yeah.
that was something that, we really had to kind of figure out how to get to, because my husband was not a big, he's not a big talker in the sense of, let me dive into my feelings and tell you how this is impacting me. And if anything, my husband is the type that, like, like I think most husbands and most partners are, like, when they see one partner in it and in
Yeah.
such disarray and distress, they want to fix, and this is not something that unfortunately can be just fixed by a,
No.
bouquet of flowers or a hug,
No.
or
You
of
need
course
more
help, but
support. You need the
you need
unpacking.
it, but they also
Yeah,
need it
they
too.
need it too. And that's, I think about your case too, specifically of like Jocelyn really, you added on extra time with Sam and
I did.
you really made it a big commitment. And then, and Joe really took a part in that too. And it was like, that's what we were talking about before we went live of, just how much of a transformation I think you two went to as together as a couple and in
Oh,
your marriage
100%.
to the point where you are
100%.
now. Yeah.
Because I will say, prior to the fertility stress, we were very blissfully happy. We hadn't come up against a ton of
Yeah.
obstacles like this that, it does at a certain point, you do feel like, I am doing so much. And there's no, I guess it's case specific, but it
Yeah.
was never a resentment thing.
No.
But it just, you just, because you're not able to align to get
Yeah.
to that goal, you get misaligned to some
Yeah.
degree.
Yeah.
And it's not always something that people can come back from.
No.
But if you do the work and you remind yourself, like, hey, wait a minute, we might be like high stress or on meds that make
Yeah.
us crazy and make us upset and fiery and whatnot, and but like, let's kind of bring it back down to, like, we're working on the same goal here. Like,
Yeah.
we're trying to make a baby with our two bodies. Like, that's what we're trying to do here, and like have more of us in this world. And that's, like, I think, what you kind of have to work towards getting to, is like just
Yeah.
staying aligned in that way. And again, it did take some help for
Yeah.
us when it got so tough. And it did get really tough.
And it
But
did. And then, so then you dedicate your 5 months in, and that's when we decided to go for that next retrieval, right?
yes, and my doctor, my reproductive endocrinologist, was just like, what are we doing? Like, you're
Yeah.
just getting older. Like,
Yeah.
in her, obviously she never said that, but she wasn't like, yeah, I'm thrilled to hear you want to wait 5 months at 38, 39. Like, she wasn't jumping up and down in support of the
Yeah.
plan. But I just, in my bones, was like, no, I need, and also too, I should say, I am the type of person that's very, if I set my mind to something, it gets done. I don't want to say like I'm type A, but I'm certainly not type B. I am much more of a, if I set out to do something,
Yeah.
it gets done, and it gets
Yeah.
done well.
That's right.
So this was very hard for me to not have the control that I wanted. And I will say, having the focus be on this egg quality diet and just feeling better and having that response in my
Yeah.
body of like, oh, I lost some weight, although that wasn't necessarily the intention, but I did have a little extra fertility baggage hanging around. But I felt great. And I just overall, like, my skin was glowing. Oh, I should also say, in addition to the diet, what I did was, I mean, detoxify as
You
much as
overhauled everything.
possible. And
Yeah.
again, these were things that I would have never thought about had it
Yeah.
not been for your program.
Yeah.
I switched from my face moisturizer with
Yeah.
SPF. You're like, let vitamin D in. Why are
Yeah.
you blocking it? And I was
Yeah.
like, that is such a good point. I live in New Jersey.
Mhm.
It was winter. I'm like
Yeah.
hiding from the sun. And let's be real, my skin didn't change that much. It's not like all of a sudden I'm wrinkly. It was six
Right.
months. I let all the vitamin D into my body. I went outside. I walked around. I'm a preschool teacher. So at the playground, I remember just looking up and looking at the kids and looking up and just aiming my face towards the sun, trying to get as much vitamin D as I could. And, you know, those types of things. I eliminated our laundry soap, and I
Yeah.
got better quality laundry soap. And what else? No, like I said, no plastic. And then I
Yeah, the
looked at my
pots and
daughter's,
pans, the whole kitchen overhaul, right?
all
Yeah.
of my daughter's,
Yeah.
everything for children is plastic. Everything is, it's like unbelievable. And you're
Right.
sitting there going like, wow, this is crazy. I am microwaving chicken nuggets on a
Plastic tray.
plastic plate and then giving her a plastic fork with a plastic cup of milk. I'm like, ugh, that is so much just not good.
Right.
And now the
Yeah.
idea of putting hot food on a plastic plate, oh, like I couldn't, it would be as if someone put dirt on my food. That's how repulsed
Right.
I am by it. And again, these are all the things that you learn through this program. And again, it's not just like, oh, please, that doesn't do anything. I mean, when you literally are told, and we'll get to this part in a second with my next retrieval, my fifth retrieval, um, when you're told that, like, wow, it does have cellular impact in your
Yeah.
body, like significant cellular impact, enhancing the quality of your food, the quality of your sleep, the quality of your, you know, just
Emotions,
everything, your emotions, your
environment. Yeah.
relationship, everything. It's just undeniable.
Yeah.
So, May 2024, I'm about 5 full months into the program. Uh, I do my fifth round of IVF. And I remember I came to my doctor and was like, I'm ready. We did exactly what we did prior. There was
Yeah.
some talk of, do we lower the dosages? Do we go
Right.
higher? What do we do here? I ended up following her guidance and kept on the higher level meds. And what we ended up doing, because again, I was retrieving
Yeah.
decent
You
numbers.
had good
Yeah,
numbers.
if I had been lower, I do think I would have done
Yeah.
more of the lower
Totally.
meds, for sure. But because I was in the teens, I felt
Yeah.
comfortable. The fifth retrieval, honestly, it was such a blur now. I don't remember the exact number of eggs, but I do remember it was less than the 16 and 15.
I
Maybe
think
it
it
was
was 11. 11 is what's
something like
coming to
that.
my mind. Yeah.
Yep.
And this is
So
her first retrieval under our belt too.
under your belt,
Yeah.
exactly. And I remember being a little nervous, like, oh,
Same.
okay. I was
It's
like,
always like, oh, let's see if it
okay,
works. Let's see if
yes.
it worked.
And
Because her
then,
previous retrieval, remember, she got no normals,
yes,
6 and nothing.
right, 6 blasts though,
Yeah,
which
yeah,
was, you know, tough because again, they did progress, just not
yeah,
where we
yeah.
wanted them. Now, fifth retrieval, I got the call 2 weeks later that they were going to be sending out 4 5-day embryos. So again, I had previously sent out 8. I had previously sent out 6. So 4 was a little like, okay. And you know, there's natural drop off. So when they called me and told me I had 2 of the 4, I almost fell to the floor.
That were euploid. That were
I
mine.
was ecstatic. So
Yeah.
2 perfect embryos to work with.
And those, I'll just say, those 2 weeks were rough. Those,
Oh,
the waiting was rough. And
terrible.
the numbers, you know, I mean, you can't help it. She's had previous retrievals. So we were comparing apples to apples. And it was like, it's hard to be like, oh, great, you know, but mind you, right, that the time you sent off 8, you got 3 normals.
Yep.
And the time you sent off 6, she got none. So we were, you know, I think
4
everybody
was less
was,
than thrilling.
yeah, 4 was less than thrilling,
Yeah,
but then to get 50% normal,
was amazing.
amazing.
And Amy, the thing that I will mention that I think I've shared as well, this was the first time that of the normals that we had made, I don't even know exactly what the gradings were, but they were
Probably
like
A's, a
A,
top grade.
B,
Yeah, yeah,
and I want to say they were both ABs.
yeah,
Previously, looking back in our file, we were more like CCs,
yeah.
BCs. We did not have any A's. So
And
when
mind
I
you, she's
tell,
also 2 years older in the process.
oh, hello, yes, I was 39
Yeah.
at that time. So the embryos I made at
Oh,
36,
actually 36.
37
Yeah, yeah,
were totally worse.
yeah.
And again, I truly accredit the changes in the embryos, or excuse me, in the quality of my eggs to the diet and
Yeah.
lifestyle changes I made through your
And the
program.
sperm. I mean, I think
Oh,
sperm
and the sperm,
really
undeniable.
transformed
Absolutely.
100%.
Absolutely. But,
Yeah.
and again, he was on the same meal plan that I
Yeah.
was.
Yeah.
You know, a little less strict. I mean, he would have like a cheeseburger when we went out to restaurants.
Yeah.
I would have, you know, the gluten-free pasta with this, or, you know, I would modify the food as, or honestly, I wasn't even really going heavy on pastas
So you weren't
because
even doing grains. You were just like
that's,
protein and
yeah,
veg. Yeah.
that's actually the other thing to keep in mind too, though anybody out there doing gluten and dairy free, you know, keep in mind, like a lot of the products that are out there now, a lot of them are nut based, which is not bad, but you know, they have a lot of other junk in it that like I truly
They're
kept it
still
more
processed. They're still
clean.
processed.
Exactly. Very processed. And you know, you think you're gluten and dairy free, but you're really like gunking up with other
Yeah.
stuff. So that was interesting to see. And again, this round I really did keep it to completely like made by me
Yeah.
or very clean, very clean. Now, that being said, we or excuse me, before we transferred, and
Full
again, this was
transfer.
another moment where my doctor was
I
like,
pushed the
what are we
hysteroscopy.
doing?
If I know
We,
myself, I pushed the hysteroscopy.
yeah.
Yeah.
And I do want to reiterate throughout this time, I had had multiple like endometrial biopsies. I had
Yeah.
my tubes checked.
Yeah.
I had
Yeah.
everything checked. Every single thing had panned out perfect.
Yeah.
Nothing was ever so is that, like I said, unexplained infertility. But the hysteroscopy was again completely normal,
Mhm.
absolutely fine. I will say I did love the doctor who did it. She called it like a uterine tune-up, like a
Yeah.
uterine facial. And I was like, that's really funny. She basically said, she's like, listen, we're going to go in there and kind of clean up, scrape a
Yeah.
little, and just kind of like rejuvenate
Mhm.
the uterine lining. And we also at that point did a Lupron depot shot, 3.7 milliliters
Yeah.
to help suppress my immune system and or whatever, suppress something. I don't know exactly what it did. I stopped asking questions
Yeah.
year 4.
Yeah. It's called a down regulator to suppress if there's any endometriosis or adenomyosis or things like that that could be impacting implantation because of her history of those 3 transfers of genetically normals, and the results, obviously the chemicals and the miscarriage, it was something that I think everybody thought was smart to do and address.
Sure. Sure. So,
That was about like a 3-week dose, I want to say.
well, it
Yeah.
was supposed to be
Yeah.
about
And
a
then
three-week
you,
dose.
I know. And
So
then she
because
got a
my
little
body
over
was
suppressed.
right, because my body was acting so optimally, I actually found out that I was very sensitive to that medication. And for the first time ever, we had talked about because I had 3 medicated transfers
Yeah.
prior, we thought we would do a natural transfer. And basically, what happened was I just didn't ovulate for the first time in my life because I had
Yeah.
been suppressed so heavily. But again, I think
And
it was
she would
because
have, if we could have waited, like I actually went through those emails today. Oddly enough, like in office hours earlier today, someone was asking about like getting over suppressed by Depo-Lupron. And then of course I had already read through your notes knowing that we were talking today. And I was like, wait, I'm going to go back to the email with Jocelyn.
yeah,
I remember it. Like I remember the
yeah,
moment. And I was like, we could have, and the doctor was like, we could wait for you to ovulate and then do that natural transfer. But you had already waited so long.
yeah,
You had September in your head, like I'm transferring in September. I think that's kind of like how I saw it. And so
sure.
then we opted to do some estrogen and support the body that way.
Yep. So we did the medicated transfer. And Aimee, you know, I really want to emphasize, like, to your credit, I think one of the best things about you and your team is that you are not just, this is the path.
Yeah.
You are flexible, you are adaptable. You know, there were times where my doctor was calling for less meds, you were calling for more meds, but traditionally you're more of a lower med person. Like that, I think is the part that people, you know, who maybe are on the fence about, do I take the plunge? Do I
Yeah.
not?
Yeah.
You know, this will be so finely tuned and tailored to you as a participant in this process with Aimee's team. And again, it will be that extra that, you know, maybe not everyone needs, but for
Yeah.
those of you that do, it's so critical to find someone that will go outside of just this is the route and do it and it will work eventually, which unfortunately is sometimes what happens.
Yeah.
Um, Now, that being said, August and September, I worked extensively with your team to
Yeah.
determine an anti-inflammatory protocol for my specific situation.
Yeah.
And this was, like I said, the part that made me realize how fully amazing you all are. Because my reproductive endocrinologist, like I said, flipping the tables here, she was pulling for lower medications to prepare me for transfer. A big part of the protocol is prednisone, leading up to the transfer. And then once you do the transfer, the prednisone stops. It was at this point that Aimee had said to me, listen, let me see your doctor or let me see your protocol from your doctor. Let's go over it and see what we think as a team. And right away, you all felt, I don't think this is the right call for you. My
Well,
doctor.
and I want to explain it too, of like,
Sure.
remember, we discover she has the clotting factor after that miscarriage of the genetically normal, the first transfer of those 3 euploids. She goes to the hematologist, they put her on the baby aspirin and the Lovenox. She then proceeds to get pregnant those next 2 times with what we know are euploid embryos, and she has chemicals. We don't, like, there's lots of ways to do it. We don't go the route of further autoimmune testing with you. It just kind of didn't fall into the cards, and it was fine.
Sure.
And I remember saying to you, if this transfer doesn't work, that's going to be my next recommendation. Like, if, because we're not putting another embryo in until we like check all the boxes.
100%.
So the doctor agrees, yes, we're going to do the baby aspirin and the Lovenox because we have this clotting factor. We're going to do prednisone. Leading up to with the transfer, right, for 5 days. Like, that's kind of a standard. We're gonna do steroids for 5 days, standard. What we see a lot in the reproductive immunology world and girls with repeat loss, and also it's just like hedging our bets, and Jocelyn can share, because you did it and she does her due diligence. The research isn't concerning for low doses of steroids in early pregnancy. Doctors really make it they're very alarmist about it. And her doctor was like that. And so I just said, I can't in good conscience be like, yeah, I check off on this transfer protocol. I really think we need a steroid involved here. We've done all this work. Like, it's kind of a cherry on top, you know what I mean? I don't know we necessarily needed it, but I just can't do in good conscience. And then you can take over from here. But her doctor's like totally against it. And we're all on the chain, and I'm like, I just don't feel right that you're going to transfer without that prednisone.
Right. And remember too, you had also included things like Pepsid and
yeah, we did an antihistamine. So it's called the antihistamine protocol. A lot of you watching know what it is. CCRM started it years ago. That's all I wanted for her. I just wanted to layer in this antihistamine protocol. Oh, and then I'll share too of like, so poor Jocelyn, of course, and a lot of you guys are in the same position. You're put in the middle. Your doctor disagrees, and you have another practitioner that says something else. And around that time, one of the girls in her cohort, who she'd become friends with, Kara, who I have yet to do her story of hope, but she's at home with the newborn right now.
She's got a baby.
Yeah, she has the baby now. She came to us. I think she had 9 losses or something insane, right? And so,
secondary infertility as well,
and not a lot of support. Like, it makes it was a very similar case, to be honest. She gets pregnant quickly on and implements all these things. And so anyway, I wound up having a call with her. She's now pregnant. We're like how pregnant you are now. And I said, I feel for Jocelyn. The doctors are giving her a lot of pushback. And I wasn't talking behind Jocelyn's back. They were sharing, and their friends. And so I said to Kara, do you mind? It makes me want to cry. I was like, do you mind when we get off, like, that you call Jocelyn and talk to her about taking the steroid? Because I think it has to come from you. I don't think it can come from me anymore. And she was like, I'm on it.
Yeah.
And
amazing.
then you can tell the rest. Yeah.
Agreed. Kara was super helpful. And again, it was that, just the extra push that I needed to hear, like, oh, someone else has done this and it has been successful and safe.
Yeah, safe.
And that was always my question. So, and again, what I loved about working with you was that I always felt like when I presented an opposing sort of question to my physician, I felt like it was always just here's my answer is no, but no explanation other than just, well, it's not safe.
Right.
But it's sort of, then when I would come to you and say, well, she's saying it's not safe, you would provide me like very specific and, very clear research that would show me, wait, hold on. Yes, prednisone is not safe when you are taking it in excess of 40 to 80 milligrams daily,
We
but
were talking
your
5.
protocol is looking at 5 milligrams daily, possibly 10, twice, like
Yeah,
once,
yeah,
5 and 5,
right.
but all the research that she's referring to is 40 and above. And I'm sitting there going, wait a second,
Yeah.
the research you're showing me is much more current, within like not yesterday, but it was
Within
up
the
to half a
2020s.
century.
Within the 2020s, I think. Yeah. Yeah.
Yes, but then also some from before where you didn't feel like, okay,
Oh,
this
right.
was like a 2 day old study.
Right.
It
Right.
was a large sample size. And, all of a sudden you're sitting there going like, wait a minute,
Yeah.
I I wonder how informed on current research they are because they have 30 years under their belt. And again, you have to do continuing medical education. I know that.
Yeah.
But I think what happens at fertility centers a lot is that, there's a protocol that works for most, and that's the protocol that gets
You
driven
fall into.
home. And unfortunately, when you are
Yeah.
that different case, like I became, you need more. And
Yeah.
I am so grateful again that you were able to take the time to look at my specifics and your team,
Yeah.
and really come up with what needed to happen. So that being said, once I was sort of like, okay, well, now I have the medical doctor who is not, on board. I have the fertility coach who is really all for it. Where do I go? And I actually sought out a third opinion. So I went to an MFM, a perinatologist who was highly regarded in my area, just for a consult, because I thought, you know what, listen, I have to just know which
Yeah.
protocol is the right one for me. And this person has seen 7 million pregnant women with such complicated cases, over the years. Like he probably
Yeah.
has heard of either of these, right? And I did just that. I sat in his office and I said, here's what's going on. I have the medical doctor who wants less. I have the fertility coach who wants more. What are we thinking? And right away he said, absolutely. He's like, I think the protocol that you're describing with the prednisone is 100% what will help you. He's like, he goes, I believe in it so much. He referenced it by name. He was very well versed on the topic of which reproductive
Yeah.
immunology is like sort of something people know about. But I'm
Yeah.
like, oh my
Yeah.
gosh, this is so critically important. But it's terrible. Like it's just
Yeah.
not embraced in fertility centers at this point, like,
No.
or at least not in mine, it was not.
No. No.
Um, and it's such a critical piece for
Yeah.
people, especially who are getting pregnant and having losses. So that being said, he was absolutely on board with Aimee's protocol and actually went as far as to say, and if your reproductive endocrinologist will not be the prescribing doctor, I would happily take you on as a patient
Yeah.
and have you. Or no, didn't even say take me on as a patient. He just said, I
You
would
prescribe for me.
happily prescribe it for you. And I was like, oh my gosh, wow. Okay. That's an
Yeah.
endorsement.
Yeah.
Not just telling me, yeah, that one will
Yeah.
work. I
Yeah.
will sign off on the
I will
script
be the
for
prescribing
you.
physician. Yeah.
Yes. So it was amazing. And then of course I was like, well, what do I do now? Because how am I going to take these meds without my reproductive endocrinologist knowing? And I have to say the MFM I'm going to, um, whose name I'd happily share if you want me to, but
Yeah. Go
um,
ahead.
Dr. David Principi out of Clifton, New Jersey. He is, he's amazing. He's like a motorcycle riding doctor too. So he's got a little bit of an edge to him, which
Yeah.
was perfect for me in that moment of like, oh, we got a rule breaker here. I like it.
Yeah. Yeah.
He actually went as far as to say, and you know what? You don't even need to tell her. And
Yeah.
I was like,
That's what we say. Like,
oh
let
my
them do their
gosh.
job. You don't have to tell them everything. It's not
Like
like
I'm
you
so
tell them all the supplements you're
honest.
taking, you know? Yeah.
Yeah. So I'm so honest. I was like, wait, what? I'm not going to tell my doctor I'm taking these meds behind her back. But truth be told, now I feel bad I said her name at the beginning, but truth be told,
Okay.
I did end up doing the protocol that you recommended while under her care, and the other doctors prescribing the following your guidance as well. We're for the scale down, because you did have to, you can't take prednisone the whole
Yeah.
time. So we
Yeah.
did scale down. And again, I listened to him and you both, where he
Right.
said, okay, at this point, I'd like to decrease. And
Yeah.
you were absolutely, let's do that.
Yeah.
And it was great. It was great to see that, yeah, after a few weeks, it was, wow, fourth
Yeah, so we do the
transfer.
transfer. She gets her positive beta, and then
Oh, yeah.
we'd been there before, obviously. So we had to get to the point of at least 12 weeks, right, before I
Oh,
think you
yeah.
really felt settled.
Yeah, absolutely. And sure enough, I graduated from the fertility center at 8 weeks. And, I'll never forget the doctor as I walked out. She was like, we just had to wait for the right one. And I just was like,
Kind of.
that wasn't it, but okay. I was like,
Yeah.
and of course, like I feel conflicted. Like I want to tell exactly what happened,
Yeah.
because I'm like, don't do the same thing 100 times. So hopefully
I
a lot of people are watching this and will listen and do something new. Um,
that's my biggest thing, that, and we cannot keep repeating the same thing.
no,
We just cannot.
no, exactly. So, yeah, so I went, and now I see the MFM just because I will be 40 when I deliver this baby. And, I can't emphasize enough the, story of hope. I hope everyone listening to this just recognizes, like, what has happened in the past does not mean it will continue. You could not have felt more scared or doubtful and down than I felt after those 6 embryos came back negative, or, abnormal. And then boom, the next one was, positives, and now will become our daughter that will complete
Yeah.
our family.
And you still have one more on ice.
And we do, which I'm like, oh boy, I don't know. I don't know how I'm going to feel about that one later. But I
Yeah.
mean, again,
You'll
like my
see. Yeah.
cup has runneth over in that
Yeah.
regard. It really is incredible to be in that position.
And that's what I was going to say. It's not a position you ever thought you'd be in.
Ever.
Well, maybe at one point you did when you first got those three, but um, yeah, it's beautiful,
Yeah.
and it's from our side, it's awesome to watch the transformation on all the levels. And I even said that to Jocelyn, like before we went live, of of course I'm always spiritual, and I really think about that piece, and I think this little one, wanted that alignment back, in all the
Yeah.
things.
In the
And
world,
yeah,
in our
yeah,
worlds.
yeah, and in your microcosm that they're coming
Yeah.
through, and it's here,
And
and
Aimee,
so,
also, I want to say, the program I signed up for was a 6 month functional fertility coaching. And if anybody was really paying attention to my timeline, I did my retrieval month 5,
yeah.
and, we were,
Well, we
emailing
don't end at
constantly.
6 months.
Yeah,
That's
like
just, we just say that.
like I
No.
said, this program, like once you are part of this group, it is, you are a part of this family that you have created, and you help grow as time goes on. But all of these intensive, very specific questions happen well outside that time. And
Yeah,
obviously, you would love to have it happen in that time frame of the 6 months. But that's the other thing, is that it's not just okay, here's the finite amount of time we are
right. And
engaged
you're
in.
done, right?
It's
And see
support.
you.
It's true support, and I can't emphasize that enough to anybody that's on the fence
Oh,
about
thank you,
whether
Jocelyn.
or not to take the plunge. I really, again, I really feel like we
Yeah,
all got me pregnant, which
I
is
agree.
amazing.
I
Um,
agree.
yeah.
No, thank you so much. So
Thank
good.
you.
I think you said it all, in the sense of, like, but I guess any last parting words of wisdom for
Oh,
those out there that were
so
where you were, the spot.
yeah, I think, there's like 3 things I think I'd like to highlight. Okay. Number one, I am proof positive that, you know, the past is not the same as the present and future, right? If you're feeling like you're
Embryo quality and egg quality can improve even
can
as you
improve,
age.
can
Yeah.
improve. Yes, yes. And anybody who wants to see otherwise, like I will show you my results. Like
Yeah.
they can
Yeah.
improve. So if you are someone that is really stressed about your age, your, you know, your weight, your this, like take control of the things you can control. You know, do what you can to
Yeah.
improve your overall health, and your whole body will flourish. And then in turn, your fertility will be enhanced. Um, so that's, I think, number one is just like, don't lose hope,
Yeah.
because you just, you never know. And if you give it your all, you know, it will improve at some point. It really will. And number two, I guess I would say, you know, like somebody said to me once, um, this isn't forever, right?
Yeah.
Like this is, you know, infertility, whatever you're navigating right now, like this is not going to be, you're not going to be 70 looking for ganarelics, or, you know, putting your legs up after relations. Like, you know, this is temporary, right? And it's in, you know, if you focus on doing everything you can in this time right now, you know, it's not that it will be the rest of your life or forever.
Yeah.
So just kind of keep it in perspective of like, you're here for now. But tomorrow you could be on your way to something
Yeah.
more
That's right.
amazing. And I also think about, which is so funny because it was at one of my like very low moments in this journey. I think Jelly Roll had just won, the musician had just won his first Grammy. And he said this beautiful speech, and he said something along the lines of like, there is a reason the windshield is bigger than the rear view mirror. And I just, that like just stuck with me
Oh,
so
yeah.
much,
Yeah.
because I never like lost sight of
Oh,
what could be ahead.
yeah.
There
Yeah.
were times I didn't feel like it could be,
Yeah.
you know, but I always felt like you're right. You have to just keep looking forward into the next thing. And those things really just help me a lot.
Yeah.
And take care of yourself and each other on this
Yeah.
journey, because
Yeah.
it's brutal. But
Yeah.
if you do what, you know, you can, and make enhancements across the board, like things do improve.
That's
Um,
right. I
yeah,
love
so I
it.
think that's what I'd say. And if you ever
Thank
have
you.
questions, feel free to
Yeah.
message me on
Yeah.
Instagram or
Oh,
anywhere.
you're so sweet.
I'm happy to share any words of encouragement, because
Thank you,
it
Jocelyn.
does take that sometimes.
Yeah. Well, thank you. And we're just so happy and honored. And yeah, it's, you know, your story is not foreign to many. And so it's so good to share the positive outcome. So thank you.
Yay.
Thank you.
Oh, well,
And
thank
thank
you
you
so
for
much.
showing up for you. I mean, that's
Oh,
really, you know, you get so much credit for that. You worked your ass off. You did.
thank you.
And I
Well,
love
thank you for inspiring me to do so. Really, I mean it, and
Oh,
supporting me all the way, and even today. So
anyways. Okay, everyone. Mwah, mwah, mwah. Thank you. And baby dust to all of you, and lots of love to
yes, baby
Jocelyn.
dust for sure.
Baby
Absolutely.
dust. Oh, thank you.
Thank you, Aimee and
Oh my
team.
gosh. Thank you so much.
Take care.
Okay.